Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health headlines. Today we're going to visit a very important topic that's relevant to almost every hospital, and it's currently under fire. It's known as 340B. Now those little numbers pack a big punch in our healthcare industry. We're going to introduce a few expert voices, but first, let's cover the basics. The following information that I'm going to provide to you was given to us by the National Rural Health Association, the Michigan Health and Hospital Association, and the American Hospital Association. So let's dive into it. What is 340B? Well, the 340B drug pricing program provides instrumental cost savings for hospitals whose resources are already stretched thin. The program serves as a lifeline for many healthcare providers. How does it do that? Well, it offers free or discounted medications to uninsured patients, free vaccines, free mental health services, medication management, and community health programs, and ultimately, it sustains operations in rural areas where access may not otherwise exist. It is a powerful program. Section 340B of the Public Health Service Act requires pharmaceutical manufacturers participating in Medicaid to sell outpatient drugs at discounted prices to healthcare organizations that serve uninsured and low-income patients. Now, these organizations include federal grantee organizations, critical access hospitals, sole community hospitals, rural referral centers, and public and nonprofit disproportionate share hospitals. Now, Hillsdale Hospital, for example, in Hillsdale, Michigan, my hospital, is a disproportionate share hospital. We are also a non-for-profit hospital. The program, created by Congress, has been an integral part of the fabric of healthcare financing since inception in 1992. 1992. And it does not require any state taxpayer dollars. Now, there is a tremendous amount of discourse right now promoted by, guess who? The pharmaceutical company, to try to dismantle this program by making false accusations about what this program actually is. So I want to dive into that. What is the threat today? Well, the 340B program is more important than ever as drug prices are continually growing and that expense for hospitals continues to grow just as rapidly. The cost of new drugs launched by pharmaceutical companies, it rose by 35% from 2022 to 2023. In 1 year, those pharmaceutical costs transferred to us as hospitals, 35% increase. I know of no other industry or no other product that has increased by 35% in 1 year. And this has been going on for decades. As major purchasers of drugs, hospitals are forced to bear a significant burden of these rising costs. And our listeners know from our other updates and guest interviews that we've held that rural hospitals are certainly in no financial position to make up these costs. Now, several drug companies are attempting to convert the way that the covered entity's access is discounted under the 340B pricing from what was described in early on is an upfront discount to now a back-end rebate. Now, this approach not only violates longstanding federal policy, but it also jeopardizes patients' access to drugs. It complicates providers' access to even those discounts. It requires that financially strapped organizations, such as our rural hospitals across this country, provide upfront financing and await the reimbursement, which adds considerable burden and cost to the healthcare system. Hospitals that operate on a shoestring budget with only days cash on hand could not front load these expenses, which means what? They don't participate, which means patients in their rural communities do not have access to this program. This is why they want to change the program, they being the pharmaceutical, because they know that strapped hospitals cannot afford the upfront cost. Now, many rural hospitals rely on contract pharmacies, they're called, due to the absence of in-house facilities. There are hospitals across the country that have pharmacies that are retail pharmacies within their hospital structure. Some do not. Restricting the number of contract pharmacies disproportionately burdens rural patients who must travel further distances to access those medications. That is a major concern, and that is what the fight is about for rural hospitals. Sustainability of a program that's been around since 1992, access to much-needed medications to those in communities who lack transportation and the financial resources to purchase it, and hospitals through a reimbursement program who do not have to pay up front, but instead have been given this funding to be able to save our community patients the extraordinary cost of these pharmaceutical drugs. Now, the following statements come from associations that advocate for hospitals and their patients. Now, there is a transparent and yet a bipartisan approach to all of these statements. I'm going to list several of them. We have the NRHA, the National Rural Health Association, and this is what their statement is. The NRHA seeks to preserve and strengthen the 340B program to protect rural healthcare specifically by opposing restrictions on the number of locations of contract pharmacies as they disproportionately impact rural areas with fewer in-house pharmacy options. NRHA advocates for equitable oversight, equitable regulation, including statutory protections against discriminatory practices by PPMs and payers that harm rural providers. NRHA recommends reducing unfunded reporting mandates for rural hospitals already burdened by extensive federal data collection requirements. NRHA hit it right on the head. They understand what is at stake for our rural community hospitals. Having limited locations for contract pharmacies limits the availability of community members to get the medicine that they need. Life-saving. The Michigan Hospital Association, their statement follows that the MHA asked members of the House Health Policy Committee to support access to affordable community-based care by passing Senate Bill 94. The proposed legislations help protect the 340B program at the state level to protect healthcare cost savings for our hospitals and the communities that they serve. One of the greatest strengths of the 340B program is the flexibility it provides hospitals to invest back into local healthcare needs. The American Hospital Association. The AHA asks to protect the 340B program for all providers and ensure the program continues to help stretch limited resources and provide more comprehensive services to more patients, thwart drug manufacturers' efforts to unilaterally and unlawfully change the 340B program as it's written, which includes efforts to change the 340B program from an upfront discount to a back-end rebate model, and support expanding the program to reach additional vulnerable communities, including investor-owned hospitals that provide care for underserved populations. Our own statement at Hillsdale Hospital. Listen, 340B helps us serve our patients. This is not gaming the system. We are using a program that has been in existence for decades, a program that provides much-needed resources to poor communities. Communities who lack transportation, communities who cannot travel 50 to 100 miles to the nearest contract pharmacy that Big Pharma wants to be able to regulate. Why Pharma wants to convert 340B to a rebate model? Listen, that does not benefit the hospitals or the patients. It's a way for them to eliminate many of the programs throughout this country. Big Pharma knows rural hospitals cannot afford, with only days cash on hand, to supplant this program with cost up front. Listen, we stand up for our patients, and we will always support initiatives and programs that bring local resources right to their backyard, that gives them the availability to seek and to obtain much-needed healthcare services and much-needed medications. We want to provide access to care. We need the partnership of government officials to recognize that Big Pharma is trying to attack this program and to take from us the availability to serve our population, all for the profitability of Big Pharma. Now, how can you help? That is the best question that we can pose today, and I'm going to answer it. If you want to speak up for 340B, use the links in the show notes to send a message to your legislator. We need rural communities, rural community leaders, rural community participants, and individuals, healthcare providers, all of us to come together and help us defend this program. That 340B program that we talk about is essential to access for healthcare. It gives valuable resources back to our local communities. This is a case where every voice matters. Thank you again to our sources for this episode, the National Rural Health Association, the Michigan Health and Hospital Association, and the American Hospital Association.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.